Welcome to the Office of Industrial Relations webcast as part of our ON series to promote rehabilitation and to return to work best practice. We are pleased to invite Endeavour Foundation to share their strategies for how they improve their rehabilitation and to return to work system across their diverse Queensland workforce. The two key changes today are updating and changing the language that your workplace use and revitalise workplace policies and procedures so they are clear and relevant for today's agile workforce. The Endeavour Foundation won the Queensland Safe Work and Return to Work Award for the Best Rehabilitation and Return to Work Management System. They have also won the Excellence in Recovery at Work for Business Award from the 2016 New South Wales Safe Work Awards. These rewards are recognition of the positive impacts these strategies have contributed to the improved return to work system. We have the Endeavour Foundation's Manager for Injury Management, Yvonne Paye, here today to give you some tips on how you can incorporate these strategies in your workplace.
Hi, my name's Yvonne Paye, Manager for Injury Management at Endeavour Foundation. Thanks for having me along today to talk about some strategies that we've put into our workplace to assist with our Recover at Work policies, processes. Firstly, Endeavour Foundation, to give you some background on what we do, we predominantly provide support to people with a disability. Nearly half of Endeavour's workforce is made up of workers with an intellectual disability. We have 2,500 support staff who support those people with a disability, and as a result of some mergers and acquisitions over the last few years, we also now have just over 400 apprentices and trainees. Endeavour has 350 sites spanning 265 locations across 3 states. Now those sites include accommodation support, learning and lifestyle services, education services, and then we have 55 business services across the 3 states that provide employment to those people with a disability. We do have challenges including our young workforce, so our apprentices and trainees certainly provide us with some challenging problems in relation to, identification of safety, of risks. We've put in place a YOLO program just recently, implemented by our Work Health and Safety team, that has addressed giving those apprentices empowering them to be able to identify risk and report risk certainly has helped a lot. From a policy and procedure and cultural perspective, in relation to our return to work processes, a number of years ago we sat down with the Work Health and Safety team and identified some strategies that we wanted to put in place that would assist with making our policies and procedures better. Literally what we do in relation to injury management as a whole, we wanted to make that a little streamlined and change the culture where we could. Very basically, what we decided to do was to change our language. We wanted to become a little more positive in the unlucky event that somebody should be injured at work. We wanted to change the language that we used throughout our culture in relation to rehabilitation and return to work. So we've set about our policy, procedure, processes, changing that wording from rehabilitation and return to work to just simply recover at work. No longer do we have a suitable duties program or a suitable duties plan. We have a recover at work plan. We have a recover at work kit. We have recover at work coordinators. So we think that the word recover is much more positive, much more supportive, and obviously we want people to be at work because we know that that's the best thing for our injured workers, and it's certainly going to have the best outcome for all. In relation to overall return to work for our workers, certainly for our people with a disability, we have support staff that can help them with wound care if needed, help administer medication, should they require pain medication or should they need that at home. Supervisors are also asked to remind our people if they need more regular breaks than they would normally have, if they have an injured limb, just to be mindful that the worker isn't using that injured limb. We also have a commitment to our families and carers of those people with a disability. You know, quite often if they have one of the people that they care for injured, it adds a bigger duress to the household. So, you know, that they really appreciate that recover at work and early return to work philosophy. Now, because Endeavour is such a diverse organisation with so many different work sites, we also have the added capacity to be able to place workers at alternative work sites. For example, should we have a support worker with an injured back who can't initially return to her pre-injury site, we can place that person into one of our recycled clothing stores where they might sort clothing, provide customer service, have seated duties. So we're very, very lucky in that way, and certainly our executive and senior management are very supportive of that flexibility that we have within our workplace. We're also currently working very closely with some other departments in relation to working from home and the ability to have people work from home in the short term should they not be able to initially return to their pre-injury role. Another idea that we implemented, another initiative, I guess we'd say, is our Injury Assist Hotline. Now, the Injury Assist Hotline is an external service that we pay a fee to access. It's provided by a company by the name of Direct Health Solutions. Now, what that involves is should a worker be injured at work, they notify their manager or supervisor, and together they would sit and ring the 1800 number. Now, when at the end of that line is a fully qualified nurse who triages the injury. She asks the worker specific questions similar to what their doctor or maybe an ED nurse might ask. Questions like, what have you done? What's your injury? What's your pain level? Literally enough questions to be able to ascertain at the end of that conversation whether or not the person, one, needs to seek medical treatment or two, can safely go back to work and have the condition or injury monitored. Obviously, this service doesn't discount the need for 000. Should somebody be injured, all of our staff are first aid qualified and they would certainly call emergency should the injury deem that necessary. But getting back to the nurse, should the worker be required to see a medical practitioner or a doctor for treatment, the nurse has the capacity to call a preferred medical provider, and that particular worker will be placed under the care of that doctor as a preferred patient, so they get straight in to see the doctor. The hotline also have the capacity to send our paperwork to the doctor at the time of the appointment. So, you know, we have a letter outlining to doctors what our recover at work processes are and the support mechanisms that we can put in place for our workers. They also provide the doctor with our recover at work kit. So we have a very good basis of early intervention and most importantly, support for our workers. Not long after the nurse takes the call, they notify the Recover at Work team via email, who then in turn notify the relevant parties and can talk to the injured worker very quickly. The nurse hotline has been a wonderful support. We've received nothing but positive feedback from our sites, especially the sites that provide employment to people with a disability. It's a wonderful level of support for those people, and it also gives peace of mind to our supervisors and line management. We did have some barriers, not only with the nurse hotline and also our new Recover at Work processes in relation to actually getting our message out to our employees. As you can imagine, with a staff base of 5,500 people, half of those being people with a disability, although we have an internal communications team and we could send lots of emails and lots of alerts out to our staff, there are obviously some people that don't have access to email. We've had some really nice, colourful, bright posters printed, so we've had those sent out to all sites. And we're working through it. We also rely heavily on our health and safety team, who have monthly area safety improvement committees, and we rely on them to share the message with managers and staff alike in relation to our Recover at Work process and our injury hotline. Sometimes it's not until it's needed that people realise the importance of it, or how simple the process is to follow and to use. Overall, the benefits we've realised as a result, I mean, obviously our health and safety team are always on the ball with updating those sort of policies and procedures, but we have achieved a massive reduction in our overall workers' compensation premium in the last few years, which has been, as you could imagine, for a not-for-profit organisation, that's dollars that can go straight back into providing support for the people with a disability. That's literally off our, bottom line. We have also managed to decrease our lost time injury frequency rate to about 8.5–9% and 8.5–9 days. So, that's one for our type of industry. We feel that's best practice and something we want to just continually get better and better at. That's an all-time best for Endeavour Foundation. So, literally monitoring these policies and processes and doing what we've done, I think, has had a very big impact on that. Thanks to everybody that's taken the time to listen today. Once again, I can't say enough how much our Recover at Work processes have assisted with Endeavour Foundation's return to work and early return to work ethos and culture. Thanks again.
Thank you for listening today. We'll have more on the On series coming up on our website. Make sure you visit at www.worksafe.qld.gov.au. Thank you.